Now, generally, for treatment of worm infections, the antibiotics that are being used, they are much more of anti-helminthics. Is it clear? So in this case, you're going to use one. You're going to have one class which is the. So we have the azoles. Is it clear? So the azoles is one of the class that can be used, like the albendazole. You're going to have mebendazole. Is it clear? So those are examples of azoles which can be used. The second class of medication that can be used, we have also the ivermectin. Ivermectin can also be used for the management. Is it clear? You have ivermectin. In addition to the ivermectin, we can also use some medications that was involved in the management of protozoans, like sulfamethoxazole, trimethoprim, or Bactrim. We can also use Bactrim in the management of these infections. Is it clear? So we can also use Bactrim. Other medication that we can use also the piperacin. Is it clear? So those are praziquantel. So you can use praziquantel. So those are different medications that we can use in the management of worms. Now, so these are general medication. Now, the specific medication for each worms, generally we need to know that the nematode is going to be targeted by the azoles. All these nematodes above here with Enterococcus vermicularis are going to be targeted by the azoles. Albendazole and mebendazole are going to target all of them. Is it clear? So now we need to know that what generally the azoles are going to target the nematodes, the cestodes, the trematodes, and those ones are much more located at the level of the gastrointestinal tract. So when you are more of in the gastrointestinal tract, the azoles are going to target you specifically with the best option. Is it clear? Generally, azoles target all worms, but the worms that it best targets are the worms that are located inside the gastrointestinal tract. Ascaris rhomycoides in the gastrointestinal tract, Necator americanus, Strongyloides, Enterococcus vermicularis, the tapeworm, and all that, those are located in the gastrointestinal tract. So the azoles are the best medication for that. Now, the other worms which are going to be located in, which are much more systemic, we have the cases of Wuchereria bancrofti, which is located in the lymphatic system. We have lower, which is located in the eyes. We have Onchocerca volvulus, which is located in the central nervous system and the eyes. Is it clear? So this type of worms are going to be much more treated by ivermectin and praziquantel. Is it clear? So what the worms that are going to have systemic spread, they are much more having systemic than the GI. They are going to be treated by ivermectin and the praziquantel. Is it clear? So those are general management, the specific management and the general management of worms that you have to know. Is it clear? So this is what you have to know. And then the last one is Bactrim. Bactrim is, you are going to add Bactrim, particularly in patients that are immunosuppressed. Is it clear? Particularly in patients that are immunosuppressed. Now you need to know that what generally when you have azoles, the medications of the cases of the Wuchereria bancrofti and all that, when you are giving this medication, what you are afraid is not actually the worm, but it has instead the anaphylactic reaction that may occur after killing the worms. Is it clear? We need to know that what unlike bacteria and protozoans, worms contain many antigens. Is it clear? So when you kill worms very fast, there may be an anaphylactic reaction. So worms that can be killed very fast with a single dose of a medication. Is it clear? So in cases of Wuchereria bancrofti, lower, and Onchocerca volvulus, they are more systemic. Is it clear? Since they are systemic, the immune response when there is those antigens after they are done is going to be excessive as compared to the worms which are going to be located much more inside the gastrointestinal tract. Is it clear? As compared to those worms, these worms here, filariasis, when you kill them with the ivermectin without giving any anti-inflammatory or any histaminic medication, you can have a severe anaphylactic reaction. So that is what we are afraid when you are giving anti-helminthic medication against the filaria. Anti-helminthic medication against the filaria. Is it clear? In filariasis, you can have after they are dead, you're going to have excessive antigen exposure to the systemic immune system. Basically, and when there's that excessive antigen exposure after they are dead, you can have destruction of the eye in the case of lower. You can have destruction of the central nervous system in case of onchocercal volvulus, and you have destruction of the lymphatic system with fibrosis, which can result to a phantiasis. Basically, so when you kill those antigen, you have to always give anti-inflammatory drugs in the management. Basically, also that is a method of prevention. Now, the later on, you're going to now visualize a class of the class of fungi. Basically,